being so damn picky.
Yeah. Can I order one
That's
incense?
extra large. What did you get?
Thank you.
I'll take an extra.
These are not form-fitting.
We'll just take one.
Just be happy.
Here we go, extra large. Will this accentuate my bust?
We'll put an eraser here.
That was there. Like that was there when everybody else came up to do
That was
from last night.
okay. Excellent, excellent. Well, I was here last night.
It was inside one of the tables when we flipped it over.
All right, so I have a scrub tech that's going to need to get up and do what? Ortho tech. I'm just going to sit here.
I need to get gown, don't I? Need someone gown me? I'll gown myself, do I?
Nope, this is all getting done right now. Patient in lateral position. Who's the doctor? Figures.
Ray, you guys need to talk Patty
Yeah.
before.
Yeah, she's not quite up yet. Who's going to help me here? Yeah, I know.
I'm gonna put next to me the down drape.
So I need this. He's not sterile here. I'm not. All right, sorry.
Come on, you guys are delaying the case. Patient's asleep.
Patient's asleep. So we have to roll this, right? I think we should shimmy her over then pull her back towards us, right? Shimmy her over that way. Because we roll her right now, she's not off the edge of the table. Right that way. Yeah.
Put your drip on my table.
A little bit.
Yep, I'm not moving.
Let's get her hips over. There we go. And roll it like that way, right? Bring her arm here. I won't let you fall.
Okay.
Fall off, catch. Go. I think we'll put one leg.
Yeah.
That. Sorry. She's gonna need head support.
Did it touch? Did that towel touch the back beat?
Oh, we were watching. I was watching. I don't think this is. Yeah, let's get scissors.
This has only been done a couple of times now. This should be a no-brainer.
More padding. Let me get that. We have enough padding here, Chris? Here. There. See, get one under her hips. Under her hips? Yeah. Yeah. There you go. You can lift her up.
No.
This one's mine.
I got 6 of them right out
One
there.
here too. Yep.
So you contaminated your back table because they touched your gloves without being
You
sterile,
really release it, you just roll over it.
right?
Yeah.
There is the
You
bean
go.
bag on the lateral, right?
On a total hip,
Over.
it'll be they'll have a hip positioner, so they'll have something up against the pubis, something up on the sacrum that kind of
Okay.
two little posts holds her in place.
Yeah.
But a bean bag is
Do hip,
we'll do
shoulder,
the same
kind of
thing.
knee. Yeah, did you get one under here as well? Nope, not yet. So if you could act like the other.
Doctor, are they doing everything right? Because you're the boss.
Go right
Yeah.
You know, you can help tie up too.
Did we get one here? We did?
Yeah, we did.
Go to third?
Here's the shoulder.
Okay.
Fucking doctor.
Ooh, look at that. This is very difficult. You have to roll.
It's my first day operating.
I have no idea if you're on that.
These guys are more interested in the head and making sure everything's right there, which we don't really care about. Right?
No, that way. We're just getting all the points that are touching.
Okay. That seems pretty good.
We got the hip, we got knee, ankle,
Shoulder.
shoulder, right here.
Did you really put something on her shoulder?
He did, yes.
Yes. It's like lying against the tape.
Elbow here,
What'd you put on her shoulder?
little pad.
Under what part of the shoulder? Nope. Not you. You keep going.
Where did we or where do we?
Where do you? Where? I know where you did it because I just asked
I
you.
think
You
you said
showed
where
me.
did you?
Doctor, is that correct? Do you want pad underneath that shoulder? Where do you want their pad? What do you call that pad specifically? Anybody want
Shoulder pad.
No, it's not a shoulder pad. Axillary
Nice.
roll.
Whatever.
I just made that. I was the one getting your case ready. When you were the guys that needed to do that. Put an axillary roll in there. Where does it go? Well, you got to lift her up. Goes right below the axilla. Not in the axilla, right below it. If you look at the shoulder one that you videotaped, it's the exact same freaking thing.
Mm-hmm.
Who videotaped the shoulder one? You
Right.
should have sent that to these guys.
Raper online?
I got
Yeah.
them all online.
You got them all online, but you couldn't figure that out.
Yeah.
That's on my, it's on my chest, it's on my arm, oh.
Right below your armpit.
Scrub Tech is up and running. What are the things that we need to pat? This is ridiculous that we got to hit this again. What are the points that need to be patted? Ankle, what else? Perineal nerve. Axillary roll. Lateral position, that's it. If it's supine position, what are we doing? Heels, behind the knees, maybe elbows, hands, depending on what we're operating on. This arm would be in a airplane spica. You won't see that, unfortunately, because we don't have an operating room table. This is the leg that you're operating on, so you won't be patting that one. Just the down leg. What about this? Did you guys forget that? Jesus Christ, you can't put this on a hip. Can't put it on a hip or a shoulder. Remember that. Who's the so now what would you do? Who's the nurse?
I am
You're the nurse. What would you be doing?
I would actually wash my hands, glove myself, and clean, but not actually.
You don't have to wash your hands. Just put your gloves on sterilely,
Right.
and then you would prep.
Yeah.
I'll ask you to put your gloves on sterilely, and you're going to hold the leg up while my ortho tech and my doctor go scrub their hands. Right? That's what I would do. So put your gloves on sterilely. Do you have gloves sterile? Or do you have your gloves up? You can ask her. She's got a whole bunch of them
I was
over
gonna
there.
grab one.
Just
Yeah.
ask her to give you one. You need gloves. Okay. Just give them just a whole the thing, paper, and everything. Yep. And hand that to him. Very good.
What's your role?
Yeah.
Now you have done that before, right?
Yeah.
Put that on sterile. Okay. Scrub your hands. Rinse. You get them gallon glove. You watch him like hawk.
I can't go lower. I went lower.
Is that right? No, it wasn't. Raymond, when you do that second glove, take your hand with the glove, put it inside the cuff before this hand touches that glove. Okay?
Yeah.
Get it inside the glove. Protect that glove from you putting it on. Did you just work your way back up?
I almost did. I felt myself turn and I was like, don't do it.
How many times have we gown and glove now? A lot. Still making mistakes. As a resident, you guys would be kicked out. If you were orthopedic residents, this would be untolerated. This would not exist. That's why you're orthotechs and not surgeons. If this was your job, it would not be tolerated as well. Lack of repetition. This is why this exists. This is why we keep struggling through this. Nope. What is she doing wrong? She's got to open that thing up, right? Yeah. Present it to her. Don't look at her for help. No, you open it. Protect your hands. There you go. Get your thumbs away. And here, I think you guys are ready to go to Kaiser and start scrubbing.
Chris, you always
This is why we get kicked out of the operating room at UCSD. Because this is a lack of repetition and focus. And you guys are just going, don't take it seriously. It's a big part of the game right here. Huge part. Question?
When she was doing that, we still do dominant hand first typically, right? When you're
Normally the right hand.
right hand.
Although I'm not going to bust you if you put the left hand first.
Okay.
You're doing everything else right, I'm happy. So you're going to hold that leg up in the air. This one right here. All you got to do is this. Externally rotate her. Yep. You've already prepped her, right? You're going to take it from one of these guys. Yep. Wait a minute, where did this person come from? Who's this person?
The janitor?
Who's this person? This person doesn't exist. Is that right or not? All right.
Just shooting.
Yeah, you're doing like the.
Orthotech, what's next?
Keep the piece holding. Someone cleans the thing. I need to get tied off.
I already cleaned it.
It's already cleaned. It's ready to go.
Then we drape. We need to be tied off by someone though. It's not sterile.
Well, there's nobody else in the room. So what do you do? You're going to be responsible for holding that leg up.
Yeah. Oh, can I hold the leg while he ties me up?
What are you going to hold that leg with? What are you going to grab it with?
I have to hold it with something that's sterile because I can't touch the body. This is not sterile. So I use.
What is it?
Yeah, there's small sterile things that we use to like.
What is it that we use?
That would keep the field.
What is it we call it?
Donut, right?
A donut. What is that donut called?
Cube.
Stockinette.
Impervious stockinette.
The impervious stockinette. Or a just regular stockinette, this game, part of the game. But guess what? It's not up on the field. What are we going to do? I got one ready to go, but your circulating nurse is busy. Your doctor's getting pissed.
Yeah.
And your scrub tech's sitting there going, I need a stockinette. I need a stockinette. So what do? What could we use?
Not to stockinette the leg, but
You could just use a towel, a blue towel.
Blue towel?
Grab a blue towel, go over there. Without contaminating your gown, you're going to hold the leg and support it. Without contaminating your gown. Which you just contaminated your gown. Because he's not tied. It's tough. This is where you get into trouble. Yes. When you're in a total joint room, they do not want you coming in and out of the room. Very few people in there. Doctors are judged on their infection rate.
But there are in general, do they? Like, it seems like.
No, they don't really care for it. UCSD, there's a lot more people running around the room.
Seems like it, yeah.
At Kaiser, not nearly as many.
No.
So what do you need? He needs a sterile stockinette. Can you open that sterile stockinette that's over there for him? Nurse. Ray.
Yes.
Did you just put your butt up against the back table? Nope, you're stuck. You can't do anything. Not you, him. Oh. Sterile stockinette needs to be opened up on that back table for, or at least given to your scrub tech. Sterile stockinette.
It's right here.
Right there. Yep. You can open that up sterilely to her. Very good. You could have opened it up, put your hand in there, and unrolled it. You know that. Or unfolded it.
But I already touched the body.
Very good. Now, doctor, you're going to have to do some work. Doctor and scrub tech are going to have to go over there, put that over the foot. You're going to get that blue towel out of there. Do not contaminate your gowns. Don't be afraid. It's not going to bite you. Get the blue towel out. Very good. Ray, you take the blue towel. Good job. Watch your gowns. Ray, get your gowns. Now, what's the next thing you need so people would quit contaminating themselves?
Down drape.
Down drape.
Down drape.
Please, someone give a down drape. Oh, we don't have one up on the table. Ray, can you open up that down drape right there?
Here it is.
See? All day long. All day long.
That's worked for me.
Now the doctor and the scrub tech got to open that thing up. Where's it going to go? Because that's where everything's going to go first, right there, right? So you want to, everybody has contaminated their gown right down there. Because that's where everyone needs to grab the leg.
Where you guys going?
Good, good, good. You don't need, it doesn't need to be perfect, just to see guys. Now what's next? So, it's already up. It's on up here. I put all sorts of shit up there just to throw you for a loop. You guys were all laughing and giggling, and I'm just like a madman, just going through shit, sticking it up there.
There you go.
Not it.
There we go.
Mm-hmm. Don't look at me, doctor. You're the doctor. That one's actually for shoulder, so we'll have a right and left. I don't really care if you use the right or the left, whatever. Is that right?
Should we go on the other side of the body?
You can switch.
Yep.
Switch it.
No, go to another.
There you go. Like a full-blown down drape. That's a good one. Or you drape. No. You gotta unpeel it. You gotta undo the adhesive. Yep, Ray, you're doing good orthotech. Set up and just hold the leg. But you don't want this up against her yet. You gotta unfold it, right? And then stick it. Peel the adhesive off. Stick it where you want it.
Can I touch this and fold it down?
You can.
I can assist,
Yours
right?
there.
So that's a lot of extra drape. What would they do
Lots
with
of
that?
extra drape.
Would they tuck it on a table? Or
Yeah,
what?
just on the table.
Push it.
Out
What
of
else
the
can you do with
Get it
it?
away from
Nothing. Nothing you can do. I got another one. You need another one, right? From the top. Doctor, why are you doing that? Scrub section.
You get paid too much.
Doctor gets to sit just on one side and help, you get to be on the opposite side. There you go. Pass over the patient. How are you going to do this? Don't touch your hair. I can touch that. Right? Can't, your gown was touching right here. Can't do that. There it is. Now you have two. One's the right, one's the left. Doesn't matter. Just pick one. Unpeel it. And stick it.
Pull one towards you or that? To her. There you go.
Yep, very good. No.
Keep the hip open.
Wait. There you go. There it is. Yeah.
Covering up the hip. Gotta cut our way to the hip, gentlemen.
Nothing's exposed.
Doesn't have to be perfect. Remember, what you want, this is actually what you don't want. See how you did that? This, you want to keep it down and just put the new one right. So any new adhesive goes on skin. So if you had adhesive down right here, say this one was up here, this one's going to go there. It would never go the opposite. Does that make sense?
The top is supposed to be exposed.
Yes, the top, the
Every
next
new
layer,
layer
every goes
adhesive.
on top. Just like that. And then you could, with the total hip, they do an extremity drape, which is not on my test, so don't, but I'm just going to make you do it anyhow since it's up. There's one right there. It has one piece of adhesive. It's going to go over top of the leg, over top of everything, and stick that down. Peel the adhesive. That's going to go towards the head. Yep, just like that. Peel that off. Put that over the leg, over the leg, over the leg.
Like
No,
goes
put-
through the hole.
Through the hole. This is something they do. We do it for total hips. Not everybody does this.
Yep.
There
There
you
you
go.
You said it's extremity?
This is an extremity. This is not on my test. Do not, when I ask you what drapes I want, this is not the drape that I want. If I ask that at all. There's a lot of shit I should be asking. Like, how do you wash your hands? Yep, it's a pouch. And your hands never go down that low.
Their body parts.
There you go. It is a pouch.
Curious what
It is a
Remember,
pouch.
The
It
stereo
is for
area
fat
is the
and gut and all sorts of nastiness.
right.
Water.
cool.
Any questions?
It's my gut pouch.
I've put you guys in almost every situation that I can possibly put you in a classroom. I can't put you, I've simulated almost everything that possibly happens on a day-to-day basis. From opening stuff that's not open yet, contamination of sleeves, dropping your hands too low, drapes not on right. We've done everything that we possibly can. We continue to make the same mistakes. I line you up for one mistake, you guys are going back to different mistakes that we've already made. Stop it. From now on in, I said this the last time, right? And then we have the foot. Is there one,